school, there was a span of a few days where I experienced this pain in my stomach. At first, I didn't really think much of it, but it gradually got worse and worse to the point where I couldn't even sit just because it hurt so bad. I actually thought I got a hernia from all the lifting I was doing, and I thought I was going to have to get surgery, so I was kind of freaking out. But I went to urgent care, got myself checked out. Turns out it was a skin infection inside my belly button. So the doctor prescribed me with an antibiotic, which I was supposed to take for a week, but after 3 days, it actually disappeared without any trace. Antibiotics have done wonders for so many patients that have bacterial infections, such as skin infections, to pneumonia, to even STDs. However, bacteria has become a lot more resistant to these antibiotics. According to a 2013 article by CBS News, 80% of Americans are prescribed some type of antibiotic annually. This just kind of goes to show how common it is for bacterial infections to develop and how revolutionary antibiotics have become in order to treat these. So in order for us to understand antibiotics, we will first go over the history of them. Second, we'll talk about how they work, and finally we'll talk about the issues that they face now and the future of antibiotics. So before I get into the history of antibiotics, I have to talk about bacteria first. Bacteria has been around since the beginning of time, but according to a 1996 article by the UC Berkeley Museum of Paleontology, bacteria was first observed and recorded in the late 1600s by Antony van Leeuwenhoek. In 1683, he observed that he had plaque in between his teeth. So he took this plaque, along with plaque from a few other people, put it under a microscope, and when he looked at the microscope, he described what he saw as animal keels that were swimming around, and it almost made the plaque seem alive. So this was the first observation and recording of bacteria, but it wasn't until the 19th century where Louis Pasteur, he determined that some diseases were caused by some bacteria. So now we fast forward to 1928, where we have Sir Alexander Fleming. According to a 2013 article written by PBS.org, he was studying a bacteria strain called Staphylococcus aureus. And he actually had a few petri dishes of these, but he went on vacation, so he just kind of set them on the side of his desk. And when he came back, he noticed that a mold had contaminated all of his dishes. This itself wasn't too interesting, but he noticed that the mold had actually killed the bacteria that was in the dishes. So he spent the next few weeks growing more mold, and he eventually named the first antibacterial agent, which is penicillin. But it wasn't until 12 years later, in 1940, that penicillin's true potential was found. And this was done by Howard Florey and Ernst Boris Chain. According to the Chemical Heritage Foundation, they conducted an experiment where they injected hemolytic streptococci into 8 mice, and then they injected 4 mice with penicillin. 16 and a half hours later, they noticed that the ones that didn't have penicillin had died, and the ones that did survived. This was obviously a huge breakthrough, and they performed a lot of more experiments after that. So in 1941, penicillin was finally ready to be tested on humans. And at this time, World War II was in full swing, so the availability of penicillin, it saved so many lives that would have been lost due to infections of even just minor wounds. So this was the beginning of the antibiotic. Since then, there have been over 100 antibiotics created. They work in one of two ways. They're either bactericidal or bacteriostatic. Bactericidal antibiotics means that they actually kill the bacteria. According to a 2015 article published by Medical News Today, once these antibiotics enter the body, they alter biochemical pathways in which the bacteria create the cell walls. So the cell walls are actually essentially thinner when they're created, and when the cells duplicate, they don't have the essential components to strengthen themselves, so the cell walls fail and the bacteria eventually die. Some common types of bactericidal antibiotics would be penicillin or amoxicillin, which are used to cure strep throat, any infections caused by E. coli, and there's so many others. The other type of antibiotic is bacteriostatic. This means that they are bacteria inhibiting. They actually slow the growth of the bacteria in order for the immune system to kill them faster. According to Dr. Catherine Senior, in a 2014 article, she states, antibiotics bind to certain ribosome structures that controls the synthesis of proteins in bacterial cell. So they essentially they affect protein production and DNA replication inside of bacteria. So the antibodies and white blood cells of the immune system can kill them faster. And tetracyclines are a group of bacteriostatic antibiotics that cure chlamydia, syphilis, and Lyme disease. Although they have many positive benefits, there are a lot of setbacks to antibiotics as well. Like many other medicines, some people do experience side effects such as rash, nausea, diarrhea, and some people even have allergic reactions. And they don't work on viruses, they only work on bacteria. And bacteria has actually become a lot more resistant to the antibiotics. According to a 2013 report from the Centers of Disease Control and Prevention, 2 million people are infected annually by resistant bugs, and 23,000 of these people actually die. The reason for this large increase of resistance is overuse and misuse. A lot of people just kind of use these antibiotics so often, even for the most minuscule infections, that their bodies become more resistant and more reliant on these drugs. And a lot of doctors actually prescribe antibiotics incorrectly for viral infections such as the cold, the flu, diarrhea, and there's no use for that. And also making new antibiotics is very costly, and it's a complex process. So the future of antibiotics actually looks pretty bleak. According to a 2015 article by Business Insider, by 2050, resistant bugs are projected to wipe 10 million people worldwide annually. They're resistant bugs. One that's up and coming is MRSA, which we heard about in a different presentation. But there's a few steps that we can take in order to just prevent infection. We should practice good personal hygiene, take a shower every day, wash your hands thoroughly, sneeze into your elbow, not into your hands, and practice safe sex. So now that I've talked about the history of antibiotics, how they work, and the future that they face, we can now take those preventative measures. Effective antibiotics are a pillar that helps us live longer, live healthier, and they're just so beneficial to modern medicine. If we don't take the necessary steps to prevent these infections, we are at large risk of losing this modern medicine, and the consequences will be devastating.